I'm going to start the recording right now, just in an effort to share it at another time. And again, I'm Stephanie Carson. I'm the News and Community Partnerships Manager with Carolina Public Press. Joining us on this call is Kate Martin, seated there with the lovely headphones, making her look very official. Ellen Acancia is also on this call, as well as editor Laura Lee and Frank Taylor, our managing editor. So it's just at 12 o'clock right now, and we're going to get started here in just a couple of minutes. We are going to remind you folks that we ask you to, you'll remain muted. If you have questions, please send them to Laura Lee, who is listed as a co-host. She's an editor with us, and she's going to be moderating the questions and sending them on to me as well. We'll also, for those of you that don't have your chat window opened up, it's a great reminder to go ahead and open up your chat. We're going to be dropping some links in there. I'm assuming many of you that are here have already read much of this investigation that we put out last week with Kate Martin. But if you'd like to look at it or reference it as we're talking about it this afternoon, feel free to click on that link that we'll be dropping in the chat here shortly. And just as we begin to start, Kate is still actively reporting on this story, which you'll find out over the course of this next hour. If you are listening today and you've got story tips for her, please email her. We'll also be dropping that in the chat as well. But if you can email her those story tips, it's probably a better space for that, and she can get back to you. We'll bring this up again, but she is specifically looking for individuals who may have experienced a delay in accessing a SANE nurse. So if specifically you have that experience and you're willing to share with her, she'd love to hear from you. We'll drop it in the chat, but her email is kmartin@carolinapublicpress.org. We'll just give it a couple of more minutes. This call will go till 1 o'clock today. So we'll be respectful of your time. I know many of you may be joining on your lunch hours. Just admitting a few extra people here, and we'll get started in just a minute. All right, we're going to go ahead and get started. I'm Stephanie Carson. I am the News and Community Partnerships Manager with Carolina Public Press. We've got Kate Martin on this call, the superstar of the show. And also on the call is Ellen Acancia. Laura Lee, our editor, is on the call. Laura is moderating our audience questions, which we ask that you share in your chat. Or in the chat and direct them to Laura. That's very helpful for us. And we'll get to your questions, as many as we possibly can. But just a few housekeeping notes. We have muted all of you, so we ask that you remain on mute just to avoid any disruptions. I know many of us are working from home these days. And also, again, if you have story tips for Kate, please email her. We're going to be dropping that in the chat. That's at kmartin@carolinapublicpress.org. She'd love to hear from you, and she's specifically looking to hear for folks that have experienced sexual assault and perhaps had a wait or a lack of access to a SANE nurse. We also want to acknowledge that, that this is a sensitive subject matter. There are people joining for a variety of reasons, so we ask that, that we all remain respectful of each other and understand that for some folks this is a difficult conversation to have because of their past experiences. We have been reporting on this, as we'll address in a minute, for 2 years now. And we have asked many folks that have experienced sexual assault about the terms survivor versus victim. And we've learned that some of them have different preferences. We have chosen to use those words interchangeably in our reporting because it's a matter of preference for the individual. We also have spoken with some that have shared with us that it's a matter of an evolution for them, that they start out feeling that they identify as a victim and then switch over to being a survivor. So just please understand that. Also, we'll be posting resources in the chat. If you are upset by something that is said or find that you need help, we want to make sure and encourage you to get that help. So, so we'll get started here. Again, I'm Stephanie Carson. Kate Martin is also on the call. Just very quickly, for those of you who don't know, Carolina Public Press is a statewide investigative news nonprofit. We're celebrating our 10th year, so stay tuned for some more celebrations with that. But we went statewide about 2 years ago, and Kate and I joined kind of right as that happened, or just after that. And Kate, this was our first project together, which, you know, there's nothing like coming out with a bang initially. So the first project was Seeking Conviction, and through that we learned quite a bit. Kate, with her wonderful data reporting, discovered that 1 in 4 sexual assault cases in North Carolina were not being prosecuted. But in that reporting, we also heard other things, and so that's what we're going to talk about today. You know, we encourage you to take a look at that Seeking Conviction project. But Kate, you know, the first question. When we were reporting on that initially, what did you learn that triggered this current investigation?
Well, in the course of reporting that series, Seeking Conviction, we learned that about 1 in 4 defendants who were charged with sexual assault were eventually convicted, which, you know, as somebody, any of you who are in the space of helping sexual assault victims or prosecuting people who are charged with it, you know, sexual assault is a very difficult crime to prosecute. Sometimes it's difficult to get victims to come forward. And there's, you know, decision points along the way that lead to the outcome that we discovered. The victim has to decide whether to go and get help. She has to decide whether to even tell anyone about it. A lot of times the first time a victim will talk about their assault is with somebody at a hospital. And the type of person that they reach at the hospital it can determine all of the other steps that are taken along the way. So when we were initially reporting about prosecution rates, I was hearing sort of side conversations, or like, did you know that, you know, such and such hospital got rid of their SANE program? Or, you know, I was hearing from other people too, like statistics about how much different cases can turn out if a SANE nurse is involved. And so I was just like, oh, well, where are they? Like, maybe I can just Google it. And so I tried naively to Google where the SANE nurses are, and, you know, there's no list online. And so I just wanted to, just in an act of curiosity, wanting to know where they were, realize that, you know, it's actually a lot more work to find out than I thought it might be. So that's kind of where the idea came from. Stephanie,
I remember
okay.
As part of our reporting, I remember being in a listening session with you in Asheville. I think that's when we first heard. We had someone with a sexual assault center said that they were having to drive victims of sexual assault 1.5 hours, 2 hours to get help, to find a SANE nurse. And I remember, you know, we were both stunned by that, you know, in that discovery. And, you know, you talked about it, it surprised you, you know. What have you learned about this process in terms of, with the lack of SANE nurses or lack of availability in some hospitals in North Carolina, how does it play out for a victim of sexual assault?
Well, I think the outcomes are drastically different depending on where you live. You have the urban areas like the Charlotte area, the Triangle, you know, Greensboro, a lot of these major metropolitan areas, they have SANE nurses, and you can show up in many of these places and have a SANE nurse in those counties or those cities they will be available 24/7. They may not be able to get to you right away, because if there's another victim there, you know, they might need to be helped, you know, before you or whatever. But increasingly, as you get to these rural areas, you either have no hospitals in some counties. There's some very small population counties in North Carolina, or they just don't have a SANE nurse for whatever reason. They have many reasons: finances, you know, there's high turnover for a number of reasons of SANE nurses, that sort of thing. And, you know, I talked to some SANE nurses who told me that they have people coming from multiple counties away, sometimes even different states, just to get to a SANE nurse.
And I think, you play it out for a victim of sexual assault that's just been through a traumatic experience. There's additional trauma then having to potentially pile in a car with someone they've not met, even if that someone is a sensitive audience, and go pursue this examination. But I know also, aside from the emotional impact it would have on a victim, there's importance to a SANE nurse evaluation that are important in the prosecution process.
Right. A prosecutor I spoke with out in Western North Carolina said that the value of a SANE nurse cannot be underestimated. You have defense attorneys who are not interested in calling a SANE nurse to the stand because, they know by now that they are highly credentialed, they know what they're doing, they go through an extensive training regimen, and to maintain that certification, it's like 300 hours over the course of 3 years, only doing stuff related to SANE exams, including performing exams, including, peer review of cases. And there's like a whole list of things that you have to do to keep your certification. And so, if you're not a SANE nurse, and it's not like it's deliberate or anything, you just don't know. Like, you might be cross-contaminating some evidence, you might not know to look for evidence of strangulation or other injuries that could be incurred during an attack or during a sexual assault. So, I think prosecutors know very well the high value that a SANE nurse has in cases like this.
And, it's about the timeline, right? And I know, I believe we have a graphic we're going to share with you in a minute, but that timeline is so important when it comes to the examination, not just getting the victim help, medical help. There's also, preventing sexually transmitted diseases and things like that, but also just creating a case, if that's something they choose to pursue, that will hold up in court.
Right. I think that's one thing that's not really talked about a whole lot in the SANE conversation around the nation about SANE nurses and the lack of them, because there is a national shortage of them. You can go to almost any state and they'd say they don't have enough. But there is a heavy focus on the prosecution aspect, but really, victims don't always want to prosecute. They should go to a SANE nurse so that they can get help for the medical needs that they have after an assault. For instance, and I didn't know this until I reported this story, but you can take medication that can prevent an HIV infection now, and HIV and hepatitis actually. And so, but you have to take it within 3 days of the attack happening, and you have to start that course of medicine. You can also take emergency contraception to prevent pregnancy, and you have to do these things within a certain time frame or it won't work. In general too, like, SANE nurses know to look for suicidal ideation and help them with other medical needs that they have as a result of the attack. So it's just very important. I don't think we can stress enough that that sexual assault survivors and victims really do need to go to the hospital or somebody who is a SANE nurse to get help after events like this. It's not just for prosecution at all.
And you touched on this, but I want to emphasize for people that there's a real disparity in geography that you discovered with SANE nurses in the state.
Right. Of the hospitals that responded, it seemed more likely that the rural hospitals with smaller populations did not have a credentialed SANE nurse. Now, I do want to talk a little bit about, hospitals did say they had people who were trained in forensic techniques, or they said, we have somebody who is in training to become a SANE nurse, or we have people who are taking the classes, but that's different than actually having the certification. You have to take an exam. There's like a whole list of steps that you have to take. And so it's not like all of the rural areas don't have anyone who can help people. Like, they do have people, but they're not certified SANE nurses.
And, on that note, you referenced reaching out to hospitals. You did do a survey, and we're going to get to that process in a minute. I think that's important for people to understand. But another thing that you pointed out to me in conversations is the importance of a separate space for the examinations and for victims to sit as they wait for them, particularly in these smaller communities where everybody knows everybody.
Yes, I've spoken to victims who have actually not gone to the hospital in their county on purpose because they knew people who worked there. They didn't want to run into them and explain, well, why are you at the hospital? Are you okay? You know, it's the same thing if you're a victim. uh, you go into the emergency room and you see all those people there, and do you want to wait in that emergency room and then see somebody that you know and them having, coming up to approach you and asking you how you're doing and why you're there? um, Best practices, after talking to multiple SANE nurses, they've they advocate for a separate space where sexual assault victims can wait outside of the emergency room, so they don't have to have that extra added anxiety on top of what's already happened to them.
And, overall, what was the most surprising thing that you found in this investigation?
Well, it felt to me like there wasn't a whole lot of consistency, even if they had SANE nurses. There, some hospitals are having people wait in emergency rooms. It didn't necessarily surprise me that, rural hospitals don't have SANE nurses. Um, I I don't know. I guess I've been a reporter for 15 years. I'm not sure if a whole lot of things really surprise me anymore, to be honest.
Well, I think, something that we learned together over the last 2
Hmm.
years is a greater awareness in the community of not re-victimizing victims of sexual assault. And this is part of that, right? That they're not having to sit in an emergency room, being
Hmm.
exposed to lack of privacy, having to be driven to find an examination, even, right down, going back to our Seeking Conviction project, how many times they're asked the same questions
Yeah.
by folks in the hospital.
I think I do want to add something to some of the survey responses that we didn't report all of the survey responses. There were a lot of them, but I did find some pretty remarkable responses. A lot of the hospitals said, "Could you please just tell people about SANE nurses? Like, we don't think people in our community know what they are. We don't think that people know that they can come for help." And it's so important for people to understand that, when something like this happens to you, you can go to the hospital and you can get help. The problem in North Carolina and many other states is that it's not consistent depending on where you live.
Right, right. And you referenced these surveys. Talk to us about your reporting process. Why did it need to start with surveys?
Yeah, I want to go back to that Google search that I initially did, trying to find out where the SANE nurses were located. I After that, I got a hold of the State Department of Health and Human Services, and I asked them, "Do you guys have, where are the SANE nurses? Can you tell me?" And they said, "Well, we don't have that information. You need to go to the Board of Nursing." And so I emailed the Board of Nursing, and they said, "We don't keep track of it either. We could tell you if someone's like a SANE nurse with a license, or not a SANE nurse. We can tell you if there's a nurse with a license, but we can't tell if they have a SANE credential." And so then they suggested I could ask the International Association of Forensic Nurses, and they do have a list online, but it's not kept up to date because people get different jobs, they move out of state, or they move to different counties, and I'm not really sure. I'm sure that maintaining a completely up to date list online, that would be like another thing on top of someone else's job, right? And so they just don't keep it up to date. And then I also asked the State Department of Justice, and they also didn't have a list either. And so, just in my quest to find, where are the SANE nurses, I was like, well, maybe I could just ask the hospitals. And so I put this survey together, and I talked to a SANE nurse in Wake County. Her name's Lauren Schwartz at Interact, and she kind of, I was like, well, what kind of questions should I ask? Like, what are some things that would be good to know? And so I talked to her about the questions, and I talked to a couple of other people about the questions, and it really kind of boiled down to like 3 or 4 issues, because I didn't want someone to have to spend a whole lot of time on it. And so basically I just wanted to know, does your hospital employ a SANE nurse on site? If so, what hours are they there for? You know, if you don't have one, how do you help the victim? Like, those are the basic questions that we had. And we also had some other questions like, what is your facility's greatest need? And that comes back to, please just tell people about SANE nurses, right? It was just, we need money to train nurses and things like that. So that's what I ended up doing, is I ended up sending a survey because nobody else had an actual accurate list.
And participation in this survey, how would you say that went with hospitals? And how long did they have to answer?
I sent the survey in November, and let's see, week of the 10th, I believe, and we gave them about a week and a half to respond. I want to say it was a little longer than that. Maybe it was 2 weeks. And so after that, we hired a couple of freelancers and they followed up after the deadline. So I would say they had at least a month and a half to fully get their answers in.
And you mentioned asking questions of the state initially, you know,
Mhm.
naively, perhaps thinking that there would be a database somewhere.
Right.
Asking advocacy groups, you know, like Interact, like NC CASA, you know, what response did they have when you were initially asking about this?
I think they were, every now and then, the NC CASA, I believe, had sent out some surveys before, like years before. Like I think occasionally different groups send out surveys, like where are the SANE nurses, that sort of thing. Um, you know, uh, I asked state lawmakers questions too. I asked Attorney General Josh Stein questions about, you know, what do you think should happen? What do you think is the solution to this? And lawmakers in general, the ones that I spoke with, said that they think that there needs to be at least one certified SANE nurse at every hospital, in every hospital system. And I think advocates, you know, they would agree with that too, and possibly would push for, you know, a SANE nurse in every emergency room. So
Right,
there's
right.
there's a strong desire for change in North Carolina on this issue, it seems.
Well, and talk to me about that. And I do want to remind folks, please message Laura Lee. She's listed as a co-host with any audience questions. She's fielding those and sending those on. But one question she got in, which kind of goes right in line with our conversation, is how could these findings be used for legislation? You know, and I know that you were already getting responses on this even before these stories published.
Yeah, exactly. I think that just how can it be used for legislation? So I think legislators can look at this reporting and see what the hospitals told me. And by the way, I don't have any kind of subpoena power, so like they don't have to talk to me, but they did for the story. And I think that lawmakers, from what I'm hearing, it sounds like they might be sending out requests to hospitals too to ask about these things as well. So I think that in general, lawmakers, just journalism in general, not my work alone, but they can use journalism as sort of a starting point for further investigation or looking into issues that could be troubling or in need of fixes.
And that makes me think of another question I meant to ask you, and actually someone else is asking as well. You know, approximately what was the response rate of hospitals? How many
So
percentage?
yeah, we had, I think it was 130 hospitals, roughly, and I'm including Interact in that, the Solis Center, and also there's another one, I forget, Sahari Center. So I sent the surveys out, and about 40 hospitals didn't respond. That was probably like 2 or 3 people who are spokespeople for multiple hospitals, right? And then we also had about 30 responses that just didn't really tell me anything. It was like, we really care about sexual assault victims and we want to make sure they're taken care of at our hospital. That was basically the whole response of a bunch of them. So it didn't tell us if they had any SANE nurses. It didn't tell us if they had anyone who even knew anything about forensic evidence collection, or who have, you know, all of the things that you can get from a credentialed SANE nurse.
And we, you know, we talk about, you talked about conversations with Attorney General Stein and other officials and departments. When you were first bringing this up to them, you know, what was your sense of how much they had already thought about this or were aware of this? Or
Well, I talked to Representative Billy Richardson. He's from the Fayetteville area, and he seemed pretty surprised that there's large areas of the state that don't seem to have any SANE nurses, or who are not credentialed as a SANE nurse. Josh Stein, it seemed like he had been thinking about this issue for a while. It's sort of one of those issues that's not necessarily a secret, but I don't think that anyone recently had done any sort of survey about it. And so, yeah.
Yeah, and I think, at times, and unless you're in that unfortunate position of needing a sane nurse, it's not something you necessarily play out in your head about. I know I didn't, even as a woman 2 years ago when we first heard of this, I was stunned by what we were told, but I had not played it out in my head
Mm-hmm.
of what it might mean to someone. And you referenced, that sometimes journalism is a kind of a peg for change, an impetus for change. Backing up to our Seeking Conviction project, just for folks that aren't aware, talk to them about the laws that changed as a result of that.
Yeah, so part of our reporting in Seeking Conviction was to talk about a couple of legal precedents regarding consent in North Carolina. It's considered a crime to have sex with somebody who's incapacitated. So it's rape, right? It's sexual assault to have sex with somebody who's incapacitated, but it didn't used to be illegal if the person had incapacitated themselves through drinking or drug use. That was changed in 2019. The governor signed a bill, the legislature passed it in both houses. Also, it used to be legal to continue having sex with somebody after they told you to stop. And this one was a 40-year-old legal precedent, and North Carolina was the only state in the country where that was the case. And because, and I don't want to just say that Seeking Conviction is what did it. I mean, reporters have been reporting on both of these consent issues for many years before I got here. But I think after Seeking Conviction, we did that project with multiple partners, TV, radio, multiple newspapers. We had reporters who were in the State House, asking questions of lawmakers like, hey, what are you going to do about this issue? And I do think that concerted effort by all reporters who helped in that series made a difference in Raleigh.
That's great. I thought it was just important to kind of back up on that, and
Yeah.
then we'll get back, just for folks that have not, read that investigation. If you haven't, I encourage you to, and we're getting some really great questions in, so we're going to get to those in a minute. I encourage, you guys to continue, those in the audience, to message Laura Lee questions, and we'll get to as many as we can. Real quick, I want to make sure that, we talked about the reaction of lawmakers and state departments. I know you had some valuable conversations. I believe it was with Deanne out of Fayetteville, with just advocates for survivors of sexual assault and their reaction to the availability of sane nurses.
Yeah, in Fayetteville, that was an interesting one. We got the response from the hospital, Cape Fear Valley, back in November, and they said they didn't have any sane nurses. And then after I started reporting, and I talked to Representative Billy Richardson, and I talked to Deanne Gertis over at Rape Crisis of Cumberland County, she didn't know that they didn't have a SANE program anymore. She was pretty devastated about that. Those people at Rape Crisis of Cumberland County, in the before times, before COVID, what would happen is if you showed up at the hospital, they would send an advocate from that group to help you get through the ordeal of the exam and make sure that you knew about all of your options, right? Throughout the pandemic, multiple hospitals said this. It's not alone. Cape Fear Valley is not alone, but victims have not had as much access to these advocates as they have in the past because of the virus taking hold. Some nonprofits like the Rape Crisis of Cumberland County, they've held their advocates back because they want their advocates to be safe. Other hospitals just have not allowed that type of visitation. And so partly possibly because of the pandemic, it could be that the communication didn't happen on that. Now, I will say after we started asking questions and Billy Richardson was talking with the CEO of the hospital, they did send in an amended survey, and it looks like they do have people in training and possibly ready to take the exam to be a credentialed SANE nurse, but it doesn't look like they actually have anyone credentialed there right now. And they're also having the victims waiting in the emergency room instead of in the side room, like many SANE nurses I've talked to said is the best practice for that.
Wow, wow. And that's really interesting. And I know we were down in Fayetteville for a forum during
Mhm.
Seeking Conviction. And, it seemed like there was great partnership at that time between, the Sexual Assault Center and the hospital. So
Mhm.
that's surprising. And just getting to some of these questions because there's some great ones coming in. You
Good.
touched on this, but just to be clear, how will these findings be used for legislation? That's your understanding? I know you mentioned that some lawmakers are seeking answers from the hospitals at this point, but what's the next steps?
I think that legislators are looking at a variety of options. Just from what I understand, they're looking at possibly more funding to ensure that hospitals have the resources to do this. They're also considering mandates possibly for sane nurses in hospitals. I mean, it's super, super early to tell. Like, there's nothing, from what I understand, nothing written down yet. They're still kind of bandying ideas about. They're still looking for co-sponsors for these types of things. So I think as the session pans out, we're going to know a lot more. I certainly don't have a crystal ball, and if I did, we could think of other options. But
And here's another great question. You're using the term certified sane nurse and sane nurse
right.
are those interchangeable terms?
No, I mean, I just want to make clear that there's a difference between being when I say sane nurse, what I mean is somebody who's gone through all the training, who's gone through all of the in-person requirements. Like, you have to you have clinical requirements, and you also have to take an exam and do everything within have at least a certain number of hours in training. So when I say sane nurse and certified sane nurse, those are the same thing. It's like somebody who's literally credentialed through the International Association of Forensic Nurses and they have that credential. Um, there are other nurses who have those skills, but they may not have the credential.
And on that note, are there alternative models for sane care, with this? So does it have to be a sane nurse? You touched on this a little bit, that some
Mm-hmm.
hospitals were utilizing.
Yeah, in Massachusetts, they have, and it's a much smaller state, so I fully acknowledge that. North Carolina is very wide geographically. Massachusetts is much smaller, but they have 30 hospitals throughout their state that basically have a sane nurse there. And there's others in rural parts of the state where they may not have a sane nurse, but there's an option to utilize what's called a telesane. So, like, the hospital can call this service that's there 24/7, and there's a sane nurse on the other end, and they kind of help them through the exam and how to help this victim. And there's other, like, I think the telesanes, they actually also work with hospitals in California and a couple other states, and I think also on some military bases and tribal lands. So
Yeah.
that's one model. I know that I think it's Indiana that has recently passed some legislation, and hospitals there have until 2022 to meet the requirements of the legislation, which in most cases, I believe, requires a sane nurse in person. Illinois, sorry. Thank you for that reminder, Frank.
No, that's fine. And you're, you touched on what I was going to ask, is just
Mhm.
comparatively to other states, are we falling ahead of behind of this issue?
I think North Carolina is with most states, where most states are not tracking this at all.
Wow. Wow, it's fascinating. I'm just going through additional questions that we're getting. So
Mhm.
pardon me as I look down, but what was the most challenging part of your reporting process?
Just making sure the hospitals responded. I don't take any personal offense to when people don't respond to me. They have reasons that they can't or won't or don't. I think it's important to try to be as fair as I can. And I was really upfront in my survey, and I said, look, if you guys don't respond, I may have to say in my reporting that you didn't respond. So I try to make sure they understand the consequences of not complying with the survey. And when I say that, I don't mean it to sound like a threat. I know it sounds like a threat, but literally I just wanted them to respond so that we could have full information. So the most challenging aspect was making sure that the hospitals responded and trying multiple avenues of getting to talk to a human or email the person who could get me the answers that we needed.
And another audience question, and just a reminder for folks, if you'll message Laura Lee, she's listed as a co-host. She's sending me the questions on. But another question is anything you would do differently in the reporting process?
I tried pretty hard to get a hold of victims. I was not successful. So if there's anyone, and Stephanie will say, we're continuing to report on this issue. There's other stories we're getting after writing this. We get more tips about it. I am really interested in talking to victims who, for whatever reason, may have experienced a delay in care, possibly went to multiple locations, who can give me their first person account of what happened. You know, I mean, I guess if I could do anything different, I would have tried harder to find a victim, but I mean, it's hard too, especially because of the pandemic. But, you know, I really feel like we need their voice in this story. And I did talk to multiple SANE nurses who said, you know, this is what the victims are experiencing. And I definitely appreciate those perspectives, but I feel like a victim's voice in this story would have made it a lot better.
And on that note, again, Kate's email is posted in the chat, but her email is kmartin@carolinapublicpress.org. And I know, you know, we learned during Seeking Conviction, you found survivors and victims of sexual assault through some of that reporting process. And, you know, one of the featured folks in those pieces bravely stepped forward at one of the events that we had. So I know, to your point, COVID, you know, prevented some of those things.
Mm-hmm.
And someone asked also, and again, you know, we're asking folks to email you tips versus put them in any kind of chat, just to respect privacy and legalities. But would you be willing to talk with someone who can't go on the record because of their affiliation with the hospital?
Yeah,
lawyer?
Absolutely. And I will say, and I'm obviously not going to name names, but I talked to multiple people on background, did not quote them, to help educate me about different aspects of this story. And I do that for many stories. I will just talk to somebody about what's going on so they can speak freely. I may not ever quote them. They can maybe even tell me, oh, did you know about this document? Or did you know about this other thing? Like, I can ask for things that and I don't have to say, like, Kate Martin told me to ask this agency, you know, for this document. No, I don't do that. I just ask for the document. So definitely please approach me with news tips. We don't have to include names. I want to know more about the issues from people who know what's going on.
And I think, you know, to that end, it's important to emphasize the investigative work that you're able to do. And it's going to sound like some shameless self-promotion, but I think it's an important delineation that you were able, because of the way we're structured as an organization, to spend months on this.
Mm-hmm.
And the realities of news gathering is that's hard to allocate in a lot of newsrooms.
Yeah, it very much is. And I used to work for news agencies where I would be writing at least one story a day, possibly two, sometimes more than that even. And just the fact that Carolina Public Press gives me the breathing room to really explore these issues in depth is, it's actually a really fun job. But it's really rare in journalism, especially in small newsrooms. We're a pretty small newsroom, so.
Right. And I think, you know, that's no knock on the legacy media. I mean, someone's got to feed the daily beast, but I think, you know, that the amount of time that you had to spend on this reporting, it was valuable and needed. I mean, there would have been no other way to gather this information.
Yeah, I mean, if I had worked at a traditional newspaper where I'm working on multiple stories a week, a story like this might have taken me a year to put together, because you do this work in between all of your other duties. Like, you file a records request and then you make a phone call for the daily story and then you wait for the records request to get back, or you send out 2 or 3 surveys a day to hospitals, or however many you can manage to get in between all of the other things that you're doing for the newspaper.
Right. No, absolutely. And I'm getting other questions as well. You know, what, if anything, does the Sbi Crime Lab say about this issue? You know, and on that note, I think we probably need to touch on the backlog of testing kits that North Carolina has had to work to resolve. But part of that question also is, are they a place for potentially tracking SANE nurses? Could the Sbi, you know, provide a solution?
You know, I don't know about that. That's actually a decent question. I don't, I may ask about that.
That's great. See, that's what this is all about, right? This is becoming a listening session as well. And we've talked about legislators, we've talked about state agencies. Specifically, what does law enforcement say about this? Do they struggle to find sane nurses, or does it even does that task even lay upon them when they're dealing with this?
I talked to a woman who I actually didn't quote in the story, but she works for like a sort of a rape crisis center somewhere out in the middle of the state. And she used to be with a law enforcement agency. And she said that sane nurses can actually help victims open up more about what happened to them. And you can't underestimate that.
No, certainly not. Certainly not. And on that note, I remember we learned in our reporting on Seeking Conviction that just the way folks tell their story, right? When they're interviewed in a hospital, first they may talk to a nurse, then they're asked to talk to a sane nurse, then they're asked to talk to a detective, and there's actually psychological principles of what happens when we're repeatedly telling stories. I don't know if you want to touch on that, because I found it was very interesting a couple of years ago when we learned about it.
Yeah, I think that there's something that happens when a traumatic event happens to you, like it changes the way your brain processes that information. And having people like police and nurses, prosecutors understand that your story may not always come out the same way when you tell it. Or even as a reporter, when I talk to people, you always want to try to be like one of the first people to talk to somebody, because they may give you a lot of detail in the first telling of the story, but repeated tellings of the story, it ends up being less detailed or less, just less detailed. I'll just go with that. And the training, from what I understand, it does help explain why the way a rape victim tells their story the way they do.
Right.
I have not personally had that training, so I can't really speak to that.
And I believe that training was called trauma informed, if I remember correctly.
I'm not sure if it has a specific name, but that's definitely one of the terms that is used.
Right. No, that's great. That's great information for folks. And we keep referencing Seeking Conviction. Laura did drop that link in the chat for those of you that want to read back on that. There's some interesting infographics on that as well. Let's see, we touched on this, but just to reiterate, are other states more successful because they have more funding? And you mentioned that most states are kind of right where we are, but the ones that are doing better, is it a budget thing or?
Well, I know Massachusetts, their Department of Health, I forget exactly the name of their agency, but it's like our DHHS, right? They get an allocation to pay for their system. I can't speak to other states. I will say just most other states are like North Carolina, where there's not really anything central or organized or provided by the state. Most hospitals are paying for this out of their own budgets. And I will say, I did talk to sane nurses who sometimes were not given vacation to go to this training. They were not paid. None of their expenses were paid. Like if you're in a rural area, imagine you have to go to Raleigh to get this training, right? You have to drive there. You have to take days off work. You have to pay for the hotel, the food, and the training. And then, maybe your hospital won't pay for it. I'm not suggesting that that's very common, but I've talked to sane nurses where that was the case.
And speaking of paying, another thing that we've learned together with this is, when someone is assaulted, who pays for that hospital visit? And you learned things about that I think surprised all of us on the team.
Yeah, I will say the state has a specific amount that they reimburse the hospitals for. Hospitals are not supposed to charge insurance. It doesn't matter what insurance that is, Medicare, Medicaid, private insurance, when they do these exams. And the reason is, imagine like you're a college student and you go to college and you get assaulted, and then you go to the hospital and you're on your parents' insurance, and all of a sudden your parents get this bill in the mail. You may not have even told your parents about this. And this is the way your parents are finding out. Like there's a reason why the state has this fund to pay for these sexual assault exams. I think some of the hospitals that I received surveys from, they mentioned that they didn't feel like the allocation was enough to pay for it. It's several $100s. I don't have that amount top of mind right now. but there's other costs too that assault victims have to pay for that are not paid for by the state. So let's say you get attacked by a high risk offender who possibly has HIV or hepatitis. You have to go through this course of medication that can cost several $1,000s. And you're going to have to pay for that. I guess the way that you would get reimbursed is you have to go through the state's crime victims fund to get reimbursed, but you still have to pay for that up front. There's no state fund or anything that will help you with that. And my understanding in talking to SANE nurses is they will like see if they can get them like the first like couple of days or so of medication, but after that they're basically on their own as to whether they can afford it.
And isn't there a differential too, whether or not the victim's willing to prosecute or involve the police in terms of whether or not the visit is paid?
Yeah, I think that if you go to police, you can get reimbursed with the fund.
Wow.
But you have to go to the police.
Wow. And, I think it's important to take a moment and stop and play this out for someone who's been through a traumatic experience. Then, they've got to find a SANE nurse. They've got to involve the police to get it paid for. Then they've got to call this fund to apply for funds. I mean, you can imagine how this could really be a deterrent to reporting, damaging to individuals and their recovery. I mean, it's pretty stunning. But so just moving on, we referenced the Rape Kit Backlog, which made national news for North Carolina several years ago. Do you have an understanding of where we are on the Rape Kit Backlog?
Yeah, I don't have that in my head right now, but actually, so initially they counted up the kits and it was about 15,000, I think it was. And they did another accounting recently and they actually found like another 1,200 kits, I think. So it was 16,200. We used to be this ignoble number. We were number one in the nation, I think, for untested kits. And they're sort of whittling away on that backlog now. My understanding is they've tested, they've tested 2,100 of those kits. And of those, DNA from 764 of them have been uploaded to the federal database. So a number of law enforcement officials have talked to me, including John Summerendike, who I believe is in the chat here. So thank you, John, for talking to us for the Seeking Conviction series. Have said that, rapists rape multiple times, right? And if you upload this information to the federal CODIS database, it's a DNA database, it's nationwide, you will find possibly other people, other victims. And so of those that were uploaded to the federal database, about 40% of those, so 300 matches, they found 300 matches. And these were untested kits, right? These were kits that were sitting around for decades. We've had these kits solved cold cases, many in Fayetteville that I'm sure John was involved in. They solved 1993 rape and kidnapping from Winston-Salem. There was an Asheville sexual assault from 2008. I mean, we could just go on and on and on with, all of the matches and the leads that police are getting out of these old kits. And who knows how many assaults have happened, since that kit was taken, since that decade or more ago, those kits were taken.
And to your point, there is a high propensity to reoffend for sexual offenders. But beyond that, I know that there's other crimes that can be discovered as well, just by nature of cross-referencing things.
Yeah, I mean, I'm sure we've all heard of the Golden State Killer, this guy who was sexually assaulting and murdering people in California through several decades. And they ended up finding him through sort of this relatively new science, genetic genealogy. They take the DNA, they upload it to a database, or they try to find matches in the family tree. And it's crazy the type of work that these people do. It's really fascinating.
Certainly. And I want to highlight in the chat for everyone, there's someone that put a link to a rape victims assistance program. So Laura's put that in the chat for anyone that may need that. And again, I do want to emphasize also in the chat, there's a link to help. So if any of you listening here need to talk to someone as a result of this conversation, because I know this is a tough topic, we encourage you to seek that out. for help. And again, you know, Kate does want to hear from you, particularly for victims or survivors of sexual assault, on what your experience has been. If you're willing to share that with her, both on or off the record. Specifically, she's looking for folks that have experienced a wait or a delay or an inavailability of a SANE nurse. You know, there's one other thing that someone has shared, that the pharma companies will also work with SANE nurses to get costs of the meds covered as well. So I think that's
good.
That's important, but that takes a SANE nurse, right, or someone at the hospital level that is aware of those programs.
Yeah, they have to know about these programs, and I'm sure, you know, SANE nurses have you know, the education for them doesn't just stop when they get that credential, right? I mean, I've heard SANE nurses tell me that, you know, they talk amongst each other. They find you know, a specific situation they may not have ever come across before, and they'll confer with their colleagues about, well, how do I get DNA off of this part, or, you know, how do I record this type of injury? Like, they talk all the time about these things, and I'm sure that getting medication to people who need them is definitely one of those topics.
Right, and I apologize for background noise on my part, but you know, talk to me at a high level, Kate.
Mm-hmm.
What's next for your reporting?
Yeah, right now I am trying to figure out which hospitals in North Carolina actually don't even perform sexual assault exams. So just to be really clear, you don't have to be a SANE nurse to perform a sexual assault exam. Any licensed nurse or doctor can do these, and there's a kit from North Carolina State Crime Lab that they put it in a box. There's a tracking number on it. It goes to the hospital, and it's got like very detailed notes on how to do this exam, which can take several hours depending on what all you're doing. And so they can follow those instructions to do it. But there's also some hospitals that I've learned that just do not do these exams at all. And I'm trying to find out why. I'm trying to find out where they are. I'm trying to see, like, you know, are there entire counties or entire prosecutorial districts that don't have any hospitals that will do these types of exams? And I am finding that there are some hospitals that just don't do them at all. I'm also working to tell a story about a prosecutor in North Carolina who did not prosecute certain cases. You know, I don't really want to share much more about that. That's coming in the next few months. So, Stephanie, you're muted.
Sorry, there's so much that is coming out of this that is just, it's remarkable. And I know, you know, just from some of the emails I've received, there are national news organizations and groups that are looking at the reporting that you're doing. And, you know, my last question, you know, as a woman discovering this, how did that make you feel?
I will say, as a human, I tried to put myself in the shoes of somebody who might be in one of these communities and trying in this most difficult time of their life to find somebody to help them, and how alone they must feel. Mm-hmm. It's a sobering thought to think that you don't have anyone to turn to when you're in such dire straits.
Right. No, it certainly is. And just a reminder for folks, you can find this particular series, Finding Nurses, on our website, as well as Seeking Conviction, which we've referenced multiple times. Also, again, just to emphasize, Carolina Public Press is a nonprofit. It's a statewide investigative news nonprofit. So those of you who feel inspired, we welcome you to donate. We want to emphasize that our content is always free. So you can subscribe to our daily newsletter. We have other specific newsletters available as well, and you can always get it on our website. In addition to that, we do also share our content with other outlets across the state. We just ask that they make it available to free for folks, because we want investigative journalism to be accessible. We do want to thank some folks. You know, Kate, you certainly were the star of the show in this instance, but there were other people involved. You know, I want to mention Frank Taylor and Laura Lee on our team, also Alicia Carter, for the photography that she did, Taylor Buck on the graphics. So I encourage you guys to pull up the series to take a look at those visual things. Christian Green and Casey Morris ended up assisting you in research, and Mariano Centillion for the beautiful illustration. But again, we want to thank all of you for joining us. This has been a very important project and topic, and there's more to come. You can follow us on social media. We're on Instagram, Twitter, and Facebook. Please subscribe to the newsletter, and we will send a follow-up email with a recording of this session. But for now, that'll do it for us. I'm Stephanie Carson with Carolina Public Press, and Kate, thank you so much for joining us.
I'm happy to be here.